We're going to see the acromial impingement syndrome. Here we have one tendon of the rotator cuff. Remember, the rotator cuff is formed by the tendon of the muscles supraspinatus, infraspinatus, teres minor, and subscapularis, and well, obviously then the deltoid. But here we're talking about the previous four of them. So there is impingement of one of the tendons on the acromial joint. There will be pain and a restriction of the movement with the following movements: overhead activity, so like doing this, overhead activity, internal rotation of the arm, or abduction of the arm. The abduction is mainly, for example, with the supraspinatus muscle. So this impingement, this could be secondary to osteophyte formation. This impingement can also lead to tear of the tendon or rotator cuff tear. So we have these tears on the next video. But here the test that we're going to do in order to see if the patient has acromial impingement syndrome, so the impairment of one of the tendons, is the following maneuvers: near test and Hawking-Kennedy test. Near test is we will do internal rotation and flexion of the arm once the scapula is stabilized. So with one hand, the doctor will stabilize the scapula, the patient will do this, and there will be the doctor with the other hand will do internal rotation and a little bit of flexion of the arm, so something like this. If you see, the arm is going to the ear, so this is the mnemonic, near ear. If there is restriction of the movement or pain, this is a positive test. And the other is the Hawking-Kennedy test. And there will be, again, a stabilization of the scapula. One hand of the medical doctor is on the scapula. The other puts the arm at 90-degree angle with the shoulder, and the elbow also at 90-degree angle. And then the doctor will do internal rotation. Again, if there is pain or restriction of the movement, this is a positive test. And these both suggest the acromial impingement syndrome. The diagnosis is made with MRI, and the treatment is conservative. If conservative treatment fails, then we can give a corticosteroid injection.